staying strong, healthy, and youthful. By subscribing, liking, and ringing, you can greatly support our channel and help us produce more content that you'll love. Hello and welcome to the Longevity Lifestyle YouTube channel. Orthostatic hypotension is a condition that affects the blood pressure of an individual when they stand up from a sitting or lying position. This drop in blood pressure can cause dizziness, lightheadedness, and even fainting. Orthostatic hypotension can be caused by various factors, and it is essential to understand the symptoms and risks associated with the condition. In this video, we'll be talking about the causes, symptoms, and risks of orthostatic hypotension and discuss the management and treatment options available. What causes orthostatic hypotension? Orthostatic hypotension occurs when the body's autonomic nervous system, ANS, fails to regulate blood pressure correctly. The ANS is responsible for regulating heart rate, blood pressure, and other vital functions in the body. When an individual stands up from a sitting or lying position, gravity causes blood to pool in the legs, reducing blood flow to the heart and brain. In response, the ANS triggers a series of physiological changes to compensate for the drop in blood pressure. The ANS increases heart rate, constricts blood vessels, and releases hormones that cause blood vessels to narrow. These changes help to maintain blood pressure and ensure that enough oxygen and nutrients are delivered to the brain. However, in some cases, the ANS fails to compensate adequately for the drop in blood pressure, leading to orthostatic hypotension. Various factors can contribute to the development of orthostatic hypotension, including medications. Several medications can cause orthostatic hypotension as a side effect. Alpha blockers, beta blockers, calcium channel blockers, diuretics, nitrates, Parkinson's disease medications. Health conditions. Several underlying health conditions can contribute to the development of orthostatic hypotension, including diabetes, heart disease, multiple system atrophy, nervous system disorders, Parkinson's disease, peripheral neuropathy. Dehydration. Dehydration can cause a drop in blood volume, which can lead to orthostatic hypotension. Aging. As we age, the ANS may become less effective at regulating blood pressure, increasing the risk of orthostatic hypotension. What are the symptoms of orthostatic hypotension? Orthostatic hypotension can cause various symptoms, which can be mild to severe, depending on the individual's overall health and the severity of the drop in blood pressure. Common symptoms include dizziness, lightheadedness, fainting or near fainting, blurred vision, confusion, weakness, fatigue, nausea. In some cases, orthostatic hypotension can cause chest pain or shortness of breath. If you experience any of these symptoms, you should seek medical attention immediately. What are the risks of orthostatic hypotension? Orthostatic hypotension can increase the risk of falls and injuries, especially in older adults. The condition can also cause accidents, such as falls from ladders or scaffolds, which can be dangerous in some occupations. In severe cases, orthostatic hypotension can cause fainting, leading to injuries or accidents. Fainting can also increase the risk of falls, which can be especially dangerous for older adults. Furthermore, orthostatic hypotension can increase the risk of heart disease and stroke. When blood pressure drops, the heart and brain may not receive enough oxygen and nutrients, leading to damage or injury. How is orthostatic hypotension diagnosed? Orthostatic hypotension can be diagnosed through a series of tests. These tests typically involve measuring blood pressure and heart rate in different positions, such as lying down, sitting, and standing. During a tilt table test, the individual lies on a table that can be tilted upright, simulating a change in position from lying down to standing up. The healthcare provider monitors blood pressure and heart rate throughout the test to determine if there is a drop in blood pressure. In some cases, additional tests may be necessary to rule out underlying health conditions that may contribute to orthostatic hypotension. How is orthostatic hypotension managed and treated? The management and treatment of orthostatic hypotension depend on the underlying cause and severity of the condition. Some common strategies include medications. Several medications can be used to treat orthostatic hypotension. Fludrocortisone. This medication helps to increase blood volume, reducing the risk of orthostatic hypotension. Midodrine. This medication can help to constrict blood vessels, increasing blood pressure and reducing the risk of orthostatic hypotension. Pyridostigmine. This medication can help to increase nerve signals to the blood vessels, increasing blood pressure and reducing the risk of orthostatic hypotension. Lifestyle changes. Making lifestyle changes can help to reduce the risk of orthostatic hypotension. Some strategies include drinking plenty of fluids. Staying hydrated can help to increase blood volume, reducing the risk of orthostatic hypotension. Avoiding alcohol and caffeine. Alcohol and caffeine can contribute to dehydration, increasing the risk of orthostatic hypotension. Eating smaller, more frequent meals. Eating smaller, more frequent meals can help to regulate blood sugar levels, reducing the risk of orthostatic hypotension. Gradually standing up. When getting up from a lying or sitting position, it is essential to do so slowly, allowing the body to adjust to the change in position gradually. Compression stockings. Wearing compression stockings can help to increase blood flow to the heart and reduce the risk of orthostatic hypotension. Other treatments. In severe cases, other treatments may be necessary, such as intravenous fluids or medications that increase blood pressure. Conclusion. Orthostatic hypotension is a condition that can be caused by various factors and can cause dizziness, lightheadedness, and even fainting. The condition can increase the risk of falls, accidents, and heart disease. It is essential to seek medical attention if you experience any symptoms of orthostatic hypotension, and to undergo diagnostic testing to determine the underlying cause. The management and treatment of orthostatic hypotension depend on the underlying cause and severity of the condition, and may include medications, lifestyle changes, compression stockings, or other treatments. Thank you for watching, and we hope this video has been informative and helpful. I recommend that you watch all the videos I upload from the beginning to gain a comprehensive understanding of the topics covered. Don't forget to like and subscribe to our channel for more videos on health and wellness. See you in the next one.